Hi, it's Yelena Ristic again for my YouTube channel, Prolotherapy and Perspective. Today it's January 3rd. I'm trying to record as many videos as I can and get them out there because people have been sending me some comments through Facebook and other social media asking for more. Um, Today I thought the best thing to talk about would be types of injury or chronic pain. But first, starting with types of injury, more or less the reason we're all interested in prolotherapy or end up turning to prolotherapy is because we're trying to treat chronic pain of some type or another. I'm going to speak the most about injury, both traumatic injury and repetitive stress injury, because that's what I actually experienced, and I can speak from my own experience, plus more knowledge than, for example, different types of chronic pain like fibromyalgia or arthritis and what exactly prolotherapy can do for that. I will mention that later, and I'm hoping to have doctors later who will interview with me and be able to inform more on things that are outside my experience and as well as bolster what I'm already sharing. Um, let's start with traumatic injury, and I've sort of defined them. I think it's easier to understand them if we give them definitions. So I've divided them into different types of traumatic injuries. Acute, obvious, short-standing trauma is one division or one category. So what I mean by acute, obvious, short-standing trauma is that it was an acute injury. It was an obvious injury. You knew you got it when you got it. It happened suddenly because of excessive force for one reason or another, whether it was being hit or falling, catching yourself, anything of that nature. And when I say short standing, I mean that you probably went to the hospital immediately. You realized you were injured, you were attended to by a doctor, and it was in one area or a few very obvious areas that could be imaged right away, that could be correctly diagnosed right away, and could be treated pretty much almost right away. There's a big difference in prolotherapy with those types of injuries as opposed to other types of injuries. The success of the prolotherapy, the type of prolotherapy, etc. First of all, if you have a small traumatic injury that is immediately correctly diagnosed and is treated with prolotherapy, your chances of healing are excellent, and diagnosis is pretty much a one-shot deal. You know what got injured, it's imaged, you see the damage clearly, the prolotherapist sees it clearly, they treat it specifically, you spend your time healing, and the focus is only on that one area. That makes that type of injury is probably the easiest to treat because it's less complex. Okay. An example of that would be, let's say, slipping in the bathroom and catching yourself on the side of the bathtub, or smashing, your arm or pulling a muscle, and you end up in emergency right afterwards. You get your imaging, whether it's an MRI or ultrasound, X-ray, whatever it is. The damage is located, and you, for some reason, already know about prolotherapy, don't want to have any other type of treatment, go for prolotherapy, or are told it can heal on its own, and decide to use prolotherapy to have it heal a little bit more quickly, maybe a lot more quickly, depending on the type of prolotherapy and the type of injury, and you're done. So most people who experience this have a pretty simple go of it. That was absolutely not me at all, and I'll tell you about that later. The second category I've divided injury into is acute, obvious, but long-standing trauma. So this is maybe as obvious as the original trauma I spoke about. It was an impact, a pull, a strain, but you couldn't or didn't seek treatment. You couldn't have treatment. Maybe you couldn't afford it. For whatever reason, the area could not be treated. you remained in pain, or it could have been a lot of pain or minimal pain, but the most important part is a compensation pattern established itself around that injury, where other muscles got involved and maybe cause more muscle dysfunction. And depending on how long standing that injury is and how much affected your kinetic chain, it could have uh, created other injuries further away from the first one, or small muscle tears around in the muscles that were distressed due to the injury, because when an area is injured, muscles will hypertrophy. They will get smaller, or they will work less, become dysfunctional in order to protect that injury. So if you've gone through that kind of a compensation pattern for months, sometimes a matter of weeks, 6, 8 weeks, depending on the nature of the injury, months, and certainly years, there's a higher and higher chance that another area was injured, or you have smaller tears that are developing around that first initial injury. So that if you have that diagnosis, your prolotherapist, unless they search for collateral injuries, may have trouble getting you to full healing, because they're treating only the original injury. Now, in my case, sometimes treatment of an original point of injury caused spontaneous healing because the tears around that particular place were smaller, so that once that place of injury stabilize, those ligaments and tendons stabilize the joint, then smaller tears spontaneously healed. So that can happen. So in other words, you can have this long-standing acute injury that gets treated much later after it originally occurred, and it only gets treated, and even if you have a little bit of collateral damage, it's healed spontaneously. Or it could get more complex, like it did in my case. You can have larger tears. It could be a really long time, and compensation patterns need to be dealt with after the fact, so that you might end up with residual pain, even though the original injury was healed and treated. So you might want to do some investigative diagnostics to take a look around the area. Your doctor's knowledge of the kinetic chain will be very important to that. I'll give you an example. In my case, the major injury, and I think the injury that originated a lot of dysfunction around it over a period of 18 years after the first injury, was a labral tear. But my ankle also got involved. So other areas on the kinetic chain were compensating, and I got a tremendous amount of healing, and then I sort of started to plateau. And then we explored the ankle. We thought, this ankle is kind of loose. It's not painful at all, but it's loose. Let's take a look at it. And we did exploratory ultrasound, even though I had no pain, and found, I think, 6 or 7 slightly torn ligaments, some medium tears, some small tears. And when I addressed, or my doctor and I addressed, the ankle with prolotherapy, I had a huge jump in healing. I'd gotten over a plateau. Just like this, within 2 or 3 months, I was dancing again. That was treating that ankle was the difference between me being able to dance and do serious footwork and me not being able to get to that level. And as I said, I had zero pain in my ankle, but it was loose. And it may have gotten loose it could have been because of the injuries I had in my back that caused muscle hypertrophy, that caused my ankle not to work properly, that over time, over years, I had been left injured, not fully healed for, the original injury probably about 20 years before I got the injuries around it, and then another 10, almost 10 years before those were treated. So a very, very long time, and I had a lot of dysfunction, kinetic chain dysfunction that developed. But if I didn't have a prolotherapist who was well trained in diagnostic ultrasound and who was willing to entertain these potential dysfunctions along the kinetic chain in the treatment plan, I wouldn't have gotten the healing that I did, not by a long shot. And that was what was lacking with some other doctors, but I'll again get into that later. So just to review, acute, obvious, short-standing trauma, which means something that happens, it's a tear, an injury that you realize has happened in the moment and gets treated in a very short period of time. I'd say within a month to 6 weeks to 2 months. You're just waiting to get your treatment. You get your treatment and you start to heal. This will cause much less collateral damage throughout the kinetic chain and much less dysfunction, if any at all. Probably easiest to treat. Second type is an acute, obvious injury. So it happened as a result of trauma, acute trauma. You knew what it was, but you couldn't get it treated. And depending on the length of time, the complexity of treating it was either less or more. And you may need to do, if you're doing prolotherapy and you're plateauing and you're not getting the results that you want, then it's really important to do some ultrasound or diagnostic imaging reconnaissance along that kinetic chain and see what else might be there that's not being treated. There might not be pain, but there might be injury and instability that is giving your injured area a hard time to heal. Then I'll go on to the third one, which I'm calling acute, non-obvious. It could be misdiagnosed and or long-standing trauma. So if I say acute, non-obvious, misdiagnosed trauma, I'll give you an example with my labral tear. When I got my labral tear that I did not know was a labral tear at the time, I was about 18 years old. I'd gone figure skating with skating. We did a little bit of figure skating, goofing around as kids. Skating with my brother. We were doing donuts, so holding hands, crossing, going in circles. He was into martial arts at the time, and he also was into doing the splits. So we were nice and warm from a few hours of skating. We came in, started doing stretches. I started trying to sit down into the splits, and I just heard a gunshot, crack. I didn't have any pain. I fell into the splits, and then I felt a bit uncomfortable, and I moved, something was wrong, and I moved out of the splits, and I felt fine. The crack was so loud that both my mother and my brother, who were a couple of feet away from me, heard it, and their heads whipped around to see what had caused the sound. I said that I had. They asked me if I was in pain. I said no. I felt fine. But the next morning, my hamstring was in a lot of pain. And I thought, darn, I was a kid. I was 18. I had no idea. I'd never pulled a muscle before. And I thought, darn, I've pulled a muscle. Okay, I'll just let it heal. 6 weeks later, the pain really didn't get any better. It was still very painful, even though I had taken it easy. I was not cycling. I was not skating. I had, just was walking and lying down and taking it very easy. So I went to go see a friend of mine, her chiropractor. She was a runner and she had a really good chiropractor. And he said, "Oh, you've torn your hamstring. I can attach you to a machine to help get you some circulation, an electrostimulation machine that'll help you recover faster." He did that for a few weeks and found that my spine was off and that I had a little bit of scoliosis. So he adjusted my spine. Maybe a couple times. I saw him maybe for 6 to 8 weeks regularly, and my hamstring pain went away. And I was functional, I was strong, everything was fine, but I did notice, now as a kid and being ignorant, I thought, okay, nobody is exactly the same left to right. When I went skating, that I had a hard time crossing over. I could cross over no problem right over left, but not left over right. And later when I started dancing, when I had to initiate a turn by putting my right foot behind me and turning behind me, I had no problem. But to do it to the left, I was always being corrected by my teacher, and I had a really hard time to put my left foot. Now again, this was before I was in pain, and I thought, okay, so people aren't even, I just have to work on this. Well, it turns out that I had already developed a problem with the range of motion. Look, I have no idea how long that problem was around. I discovered it most obviously when I started dancing and doing turns, because I had a hard time doing them evenly left to right, right to left. So again, when I say it's an acute, non-obvious, misdiagnosed injury, I heard the crack, I felt the pain, I got treatment for a torn hamstring, but I never got treatment for an underlying labral tear. And that tear might have been small at the time. It might have gotten bigger as I danced flamenco, which I quite believe it could have. We don't know 100% for sure. But the point is, I was left with residual lack of range of motion. And that's very common.